intense, so it's a little bit more tolerable. Not 100%, but it helps a little bit. And the prosthetics department put me in a shrinker sock, and they also want this like nice figure 8 pattern with the Old Bandages to decrease the size of the stump, which for me has been great because it's like not very swollen, which has been, from what I hear, pretty good sign. The only downside is that, we just need hand sanitizer?
Did you have it on your end table?
No. The only downside is that I've got all that black tissue at the end, which unfortunately could be good or could be bad. It does honestly look like it's improving. I need a Band-Aid too, honey. And we'll just, for good measure, take these off. I just need an alcohol swab, 2 alcohol soaked swabs, 1 super sponge, 1 gauze wrap. We need those scissors, the sterilized scissors. Got it down to like a science. And I just need gloves and that alcohol swab. So basically, we're told all this black tissue will just sort of grow up and out and slough off. In 2 weeks, I'll take out all these stitches. Right now, I'm exactly 3 weeks post-op. And then all the stitches will come out, and hopefully this wound will look a lot better and the tissue will look more viable. And then they can start really aggressively shrinking and start fitting sockets. And then once the sockets are fit, I can start weight bearing and start getting back to life. So we're just gonna get de-germed. Step 1, de-germ. That should be good, bub. I like to take my ring off too because there's so much bacteria in rings. So this is just kind of like the spots where the pads were before kind of get gunked and unsticky. And so the alcohol not only helps to sort of kill the bacteria, but I need a Band-Aid too.
Yep,
You can just put that right down in the bag if you want. I just like to clean it up a little bit, dry up the skin a little bit, clean up all the gub, the goo and yuck yuck. That's a medical term, the yuck yuck. Get all the yuck yuck cleaned up. Good news is, like, it's not tender anywhere, like the whole thing. Nothing's tender except right here, which I don't touch openly without gloves. So that one is a dirty one in the dirty pile, and then I'll use gloves for the rest of it. I've got my handsome first assist. And I cut myself the other day with a Band-Aid. I mean, I cut myself not with a Band-Aid. I covered it with a Band-Aid. I cut myself, I don't even know how, just picking it with my finger. And a little area of blood started leaking, and we thought it was because I had fallen. So there was all this alarm sounding around it. Ended up being just a little tiny piece of skin that I nicked, which was good news. So I just rubbed the skin with alcohol, keep it dry, hopefully keep the bacteria at bay. And I don't actually know if it's helping or not. I'm just doing it to do something. All right. Next is the Band-Aid, once it's nice and dry. And then we replace the electrodes 2 inches away from each other, ideally. So kind of do it. And try to do it in a little bit of a different fashion each time so that the skin doesn't get too irritated. But it's all ballparked. And then we need a super sponge. And give me the gauze, baby. And we'll do gauze. So really they don't like a lot of bulk on it, so as much as you need to just dress the wound, which for us is just one dressing, and then half of one large ace, this is an ace, one large gauze wrap, sorry. And the trick is that you want to get enough on so it secures the bandage that you just put down. It doesn't compress and doesn't, and what?
Bottom's still open.
Bottom's still open, so then we'll do this fancy little trick we learned. Is that good?
Mm-hmm.
Can you? Should be good. And you can actually cut it right there. So that's actually it. And then we do the tape. So this is done, it can be every other day, but because I've fallen recently, they prefer for it to be every day. And now we dawn, right? So this is the tighter of the two devices, the compression shrinker socks that we've been given. And this one we haven't tried before, so hopefully it fits. But you basically put it on this big old piece of plastic. Wanna help me, honey? Just push it down. So you really try to get it flattened. Yeah. And then while you keep it flattened, you just put the nub at the end and then you let go. And you just roll very gently. You roll the sock right up. This is called a donning device. So it just allows you to put it on because otherwise it would be very challenging to roll it up. And that's the shrinker sock. And then the additional compression, if warranted by the prosthetist, is just essentially a series of figure eights that go around sort of the end of the limb that I'm not the greatest at doing yet. I'm still learning. But it actually didn't turn out too bad, did it?
No,
yeah. And then we would just tape that. I'll grab me a little slice of that pie. And then we would roll the shrinker sock down, plug in the TENS unit to help with all of the nerve activity. And then it's just another day in paradise until we check on it again. And we usually take pictures if it looks any different and send it to the doctors. I only actually, you could do, yeah, that's fine. You could do two. And that's it. And then the leg's ready to, I use this fun Angelina Jolie, you know, leg strap like in Tomb Raider where she's got the gun on it. But instead mine's just for my nerve pain. And that sort of sits there, and then you connect these tubes, these little ports here, and then you would plug that in, but I'm gonna give it a little bit of a break for a bit because it's so hot today. That's it. It's the life of a change.
Great.